Little video for EMS 257 Paramedic Pharmacology discussing autonomic nervous system. Remember, our nervous system is divided into two parts, the central nervous system and the peripheral nervous system. The central nervous system is primarily the brain and spinal cord, peripheral is everything else. The peripheral nervous system is further divided into the autonomic and the somatic. The autonomic is the involuntary and the somatic is the voluntary. The involuntary can further be divided into the sympathetic nervous system and parasympathetic nervous system. The nerves come off the spinal cord and make a short run to a collection of nerves called the ganglion. And there's a synapse here between the ones coming off the spinal cord and the ones going to the body, which would go to like the heart or the intestines or the liver. So this happens when you have a neuron come off. There's then a neurotransmitter released, and in the sympathetic side of things, it's acetylcholine and cholinergic receptors. This then stimulates another neuron, which releases norepinephrine, which then causes the organ at the adrenergic receptor to begin to work harder. In this case, the heart would beat faster. Sympathetic nervous system comes from the thoracic and lumbar regions of the spinal cord, and they innervate the different organs in the body. It causes the muscles, or in the muscles, it causes blood flow to increase to the large skeletal muscles. It causes the heart to beat stronger and faster. It causes the bronchioles to dilate or get bigger so we can take in more oxygen. And it causes the liver to release glucose. This all is our fight or flight, allowing us to run faster or fight harder. The receptors on the sympathetic nervous system are called the dopaminergic and the adrenergic. The dopaminergic and the adrenergic. The adrenergic are further divided into alpha 1, alpha 2, beta 1, and beta 2. You've probably heard those before. Alpha 1 causes vasoconstriction, causes the heart to beat a little bit faster, although it slows the heart rate just a little. Alpha 2 causes vasoconstriction. Beta 1 works on the heart and causes the heart to beat faster, stronger, and the electrical impulses to stimulate a little bit faster. Beta 2 works on the lungs, causes bronchodilation, but also a little bit of peripheral vasodilation and other smooth muscle relaxation. The dopaminergic are renal and mesenteric vasodilators, allowing more blood flow to that area. The parasympathetic nervous system starts in the brainstem and then the sacral part of the spinal cord. The ones going to the brainstem primarily go to the nerves in the head and face, except for the cranial nerve, which is the vagus nerve and goes down to the heart. The sacral nerve goes to the kidneys, bladder, sex organs, and large intestines and controls those. All this causes pupil constriction, a little salivation to increase or assist with digestive tract activity, bronchodilation, and slows down the heart. The parasympathetic nervous system releases acetylcholine, and it has two receptors, nicotinic and muscarinic. Hope that helps. Let me know if you have any questions in class or in the comments below.